Senator Mitchell, then Senator Pavley has left some questions she had to leave, and then Senator Stone.
Thank you very much, Mr. Chair. I appreciate the opportunity and want to echo Senator Nielsen's point about the important critical work that this committee undertakes. And I look forward to serving as chair of Budget Sub 3 this year with my colleague, Senator Monning, and Senator Stone. We're going to have a blast. So I look forward to serving with both of you. Process, kind of overarching question I want to start with, just based on some of the conversation today and a California Budget Project blog that I read just this week, where they documented that every year consistently over the past, I think it was 10 years plus, that finance has pretty significantly underestimated revenue every year. I appreciate that revenue, that's both art and science to project and estimate revenue. But when I couple that with the conversation we had today about just one department, Department of Corrections, and the concern consistently every year about how we under budget and then they have to come back and ask for more money, it really gives me cause for pause as a legislator to really question the information I'm given and the basis upon which I make decisions and cast a vote as a member of the legislature on the budget. And so I guess my question to you, Ms. Bossler, is how can I be certain that the projections upon which this year's budget were based are more accurate than past experience, given this documented trend?
Personal income tax forecasts in the state of California are very difficult, and that's because of one factor and one factor alone, and that's really capital gains. And the behavior of those taxpayers that make most of their money from the stock market. There are wide swings in those revenues every year. We do our very best to do a good, solid, middle-of-the-road estimate of what we think is most likely to happen. Sometimes we have been low, sometimes we have been high and have had to revise down, but we put forward our best foot in terms of using all of the data that we have before us, including the most recent data that we have, to really build a projection that we think is what is going to happen. There has been a lot of well-documented differences between our estimates and the LAO's estimates. The vast majority of the differences are related to those estimates surrounding capital gains. And so that is really an area that many smart people have been in rooms and have tried to figure out the differences, but it is just a very difficult component of income to predict, and therefore the revenues as well to the state of California.
To the point that we raised today with regard to the Department of Corrections, when I served in the Assembly and the Budget Committee, there were a number of hearings led by the Budget Committee Chair then around zero-based budgeting and how that was a growing goal of the state. And there were a number of departments and programs within the department that had begun the process. Where are we in that process, and will we ever get to a point where the budgets of departments will be formulated using that kind of methodology?
We continue to utilize zero-based budgeting to target specific departments. Over the past several years, we have done zero-based budgeting on several different divisions within the Department of Transportation and Caltrans. A few years ago now, we did do the blueprint for corrections, which was really building their budget up from the ground up, as opposed to building on what we've had in the past. We've taken a look at parks. There are many other departments as well that we continue to do targeted approaches to really deconstructing the budget as it has been historically and look at what are the drivers, what are the needs. And so that's something that we continue to work on. We also, in our audits division, also do targeted audits of programs in departments as well.
And in those instances, were we closer to the mark compared to the examples we've heard today with regard to corrections?
So corrections for many years did go far, did have deficiencies. That was something that occurred. We actually have not had a deficiency in the Department of Corrections for the last several years, and that's partly mainly due to a lot of vigilance on behalf of the administration and the legislature in ensuring that that the department stays within budget. Also, there had been some systemic underfunding that had occurred, and those things were also right-sized as well over the last several years.
So in the examples, the experiences we've had with the programs and departments where we've utilized zero-based budgeting as a process or methodology, have we been closer to the mark?
Absolutely. I think that it does result in recommendations and proposed changes to the budget. Absolutely.
And any sense of timing as to when we could look at that, expanding the use of that methodology to other departments?
We continue to work on it on a case-by-case basis, but we'd be happy to have a conversation about how to expand that to other departments.
The conversation Senator Block initiated with regard to trying to figure out what the new investments in K through 12 are, have we moved from the basement to the first floor or just up a couple rungs on the staircase? And it occurred to me that we don't have that same kind of measure to give us a sense of the impact of the disinvestment in many of the health and human services areas. And really, I guess it's a question for Mr. Taylor and the LAO. When we recognize, listening to Senator Monty, listening to Senator Pan about the magnitude of disinvestments we've made in that area, is there any, have you done any analysis, is there any itemized list to really give us an overall sense of, since we experienced the Great Recession and the billions of dollars we've cut from these core life-sustaining programs, do we have a sense of where they are and the cumulative impact?
Senator, we've been looking at that, and it is a more complicated story than you would think.
Right.
I think the DDS is an interesting story. If you looked at their total expenditures, they've grown pretty substantially. However, if you dig into it, you see, well, it's largely because the caseload has skyrocketed even over the recession period.
Right.
So then if you look at the per client expenditures, especially if you want to adjust for inflation, that's gone down. So it kind of depends on what story. Some would say, well, you haven't really disinvested it. You've increased spending mightily in this program area. But then you have to go in and look at, well, adjust it for caseload, adjust for various things. Certainly there are certain areas, like in your CalWORKS grants, your SSI, SSP grants, where you've not been giving COLAs over the entire period. So in real terms, those people are getting less than what they got. So that's easier to sort of quantify. In health, you clearly are spending a lot more money on Medi-Cal. You cut back on some of your smaller grant programs that you didn't restore. Overall, your spending is probably way up. IHSS, similar story. Expenditures have grown, but after you adjust for caseload, you get these different stories. So certainly we're going to be spending more time looking at the exact question that you've raised, and hopefully we can maybe give you some perspectives on the very question you're asking.
That would be very helpful as we move into our sub-3 deliberations. Given the lateness of the hour, and I have colleagues who have additional questions, I won't dig too deeply other than to echo the sentiments raised by Senator Manning, Dr. Pan. When we begin the subcommittee hearings, we will have very concrete questions around the impact of the 24-month time clock on CalWORKS and early care and education, while we have clearly expanded expectations around work requirements, the employment services, and recognizing that the general caseload has increased, why we would be looking at a reduction in child care slots in the AP program in stage 2 doesn't pencil out from my perspective. So I'll save those questions to sub-3, but what I do want to just generally address, since you raised it in your presentation, is this slide entitled Addressing Poverty and Income Inequality. And my aha moment, my initial aha moment was, maybe it's a semantics issue, maybe it's me. But when you, in your presentation, Ms. Bossler, said poverty reduction, and then I look at the 6 bullets on this chart, it's fascinating to me that these actions would be considered poverty reduction by the administration. When, from my perspective, when you look at research-based general theory on what it will take to reduce poverty in the state of California, most of these aren't in the same chapter, much less book. Increase in the minimum wage, no-brainer, of course. But when we talk about a very modest 10% increase in CalWORKs, that's not poverty reduction, that's poverty maintenance. Because we're clear, the average CalWORKs grant today maintains a family far below poverty. And so I think it's going to be important that we try to figure out how we get on the same page and have a meaningful, relevant conversation in this state about, if there is indeed a commitment to reducing poverty. Many of the programs listed here, locally controlled funding, these are services to poor people, yes. Poverty reduction, I would argue no. So I appreciate this chart. It sheds some light for me in terms of perhaps I am from Mars, the administration is from Venus, I'm not sure. But we really do have to have a meaningful conversation, because when you talk about the $1.2 billion funding for a coordinated workforce development system, we need to have a clear conversation about how the administration believes that will reduce the number of children living in poverty in the state of California. I was surprised that the investments that the legislature has led, that the administration has supported in the subsidized child care program was not on this list, where that has a direct impact on the pocketbook of a mother living in poverty in terms of her ability to pay for child care or pay for food or pay her utility bill. So I think this chart and the items that you've chosen to list will be topic of much conversation in the context of sub 3. Thank you, sir.
Thank you, Senator Mitchell. And in particular on your last comments, even the aha of raising the minimum wage is still poverty maintenance.
Right.
Because even next year when we get to $10 an hour for a family of 4, that's $20,000 a year, federal poverty lines, $23,000. So we still have work to do even on raising the minimum wage. Senator Stone.
Thank you to Senator Leno and Senator Mitchell. I look forward to working with you on S3 and Dr. Pan as well. As a healthcare professional, I certainly can relate to the deficiencies in the Medi-Cal rates in the state of California, and we have roughly 30% of the state's population now on Medi-Cal. I see that the budget does not restore the 10% cut in Medi-Cal, and I know the temporary hike for physicians has gone away as well. So we have an expanding population of people utilizing the Medi-Cal system, and I'm not sure we're going to have physicians that are going to be willing to accept the insurance when the cost or the revenue they receive for seeing Medi-Cal patients doesn't even cover their costs. So I see this as a potential medical catastrophe in the making as we embark on our budget. What is the administration doing to ensure that physicians will get an appropriate fee to ensure that the population, 30% of the state, is going to have appropriate services and have a place to go?
Well, this is an ongoing effort. The administration, the Department of Healthcare Services, does monitor access and make adjustments when deemed necessary. Also, the administration is in the midst of putting together a new 1115 waiver with the federal government. This has many different strategies for really transforming and improving access to care for the recipients of Medi-Cal. And there, are many efforts underway by the department to continue to work with our managed care organizations to ensure that the program is working. We understand that this is a tremendous amount of change that has happened over the last few years, that this is a work in progress, that more needs to be done. That is something that we continue to be committed to the success of the Affordable Care Act and implementing it.
Okay, so you say that when you see these warning signs that you intervene. Can you tell me the last time the administration intervened on the issue of reimbursement to physicians and their lack of participation in the plan, because it's not a catastrophe in the future. It's a catastrophe today in ensuring that we have a pool of physicians that are going to be able to take care of these worthy citizens.
Adam Dorsey, Department of Finance. So the state plan is the contract that governs the state's relationship with the federal government and the state Medicaid program. And under the state plan, we're required to monitor access. And the most recent place where we've done that was with CBAS centers in San Francisco. It was a regionally based forgiveness of the rate reductions there. But we've had a whole host of areas where we've forgiven the 10% provider rate reduction in the Medi-Cal program over the last couple of years. We don't apply the reduction to high-cost pharmacy. We don't apply the reduction to specialists and managed care organizations. And there's been a number of others as well where we've forgiven the reduction in order to make sure the beneficiaries have access to the benefit.
You've forgiven the reduction that exacerbates the existing problem. The existing problem is that they haven't had a rate increase that would allow them to participate in the program. So I'm curious if the LAO would weigh in on the existing structure of Medi-Cal and reimbursement to physicians for their services.
Certainly, Sean Martin, Legislative Analyst's Office. Last year in our budget analysis, we emphasized a shift in the Medi-Cal program, which is a shift away from the fee-for-service program towards managed care. I'd like to point out that over 70% of our Medi-Cal enrollees will be enrolled in managed care now and in the future. So we suggested that the legislature pivot towards sharper oversight of managed care, specifically in terms of quality and access. And in fact, SB 964 was passed last year, which moves the legislature in that direction. We also discussed fee-for-service, and there's not much data for us to tell you whether the increase in rates to providers in fee-for-service is actually going to improve access to care. But what we did suggest is that you're going to have certain areas in fee-for-service that are carved out of managed care. For example, Denti-Cal. And we think the legislature should move towards requiring the Department of Health Care Services to report more data and that would allow us to better assess the level of access in the Denti-Cal program.
Does the state of California compare the reimbursement or the payment rates to physicians in comparison to other states to see where we fit on the mean?
There are a number of entities that make those types of studies, and we typically come in very low in terms of our fee-for-service reimbursements.
Which is indicative of the problem. Thank you for your answers. I appreciate that. I also want to say for the record that I support Senator Monning and Senator Leno with disabled individuals in the state of California, especially with the growing autism problem, and empowering and helping the regional centers, which is something that's very important to me and very dear to my family and friends. I look forward to working with you on that. So I'd like to jump, if I could, quickly to corrections once again. And I'm speaking as a former elected official in the county of Riverside. And, you know, every May, we always get nervous in local government as to what the state of California is going to do to us this year. And certainly realignment was a tremendous opportunity for local government to partner with the state of California and trying to help with the federal mandate of reducing the prison population. I think 24,000 in the first wave. And the administration promised local government that we would seek a constitutional guarantee to make sure that local governments were made whole. And I can tell you, being a member of the Board of Supervisors, being a member of CSAC, that I think if you poll most of your local elected officials in counties that now have to bear this responsibility of oversight of prisoners, that we get about 60 cents on the dollar for what it costs to take care of all of these prison realignments, if you will, and putting people that would have formerly gone to state prison into our local jail system. So if you look at the realignment rates that took effect on October 1st, 2011, and you compare to 2012-13, it makes sense that you would see a decrease in costs for the state of California commensurate with the shifting of those costs to local government. So the trending was moving in the appropriate direction. But if you look at 2013-14 now to 2015-16, we see this steep incline. So we've seen a decrease in the prison population, shifting of costs more to local government. And yet we see that we have a corrections increase request in the budget, which doesn't make a whole lot of sense to me. The goal of realignment was, of course, to decrease the prison population, decrease recidivism, which we embrace at the local level. But the problem at the local level is we're not getting the resources to accomplish those goals, nor do we have the funding, and I support Senator Nielsen's request that we have some funding for data collection to find out if this grand experiment in state incarceration reforms really does, in fact, do what it was intended to do. So I'd like to hear your perspective on what the governor plans on doing as far as keeping his promise to local government to make sure that they have the resources necessary, and why are we seeing an increased cost with a decreased responsibility at the state level?
So Proposition 30 did dedicate a portion of the state sales tax to realignment as well as VLF monies. And this year alone, $7.2 billion from those revenue sources will be going to counties and cities to a lesser extent for various realignment expenditures. Specifically related to the law enforcement services, which is a significant part of realignment. There'll be nearly $2.3 billion going to locals in the budget year to address the local law enforcement impacts of realignment. In terms of the decreased prison population and the further population reductions that the three-judge panel has required so that we can continue to work towards reducing the prison population below the level set by the court, there is additional money. It's $16 million in this budget to go to county probation to supervise those additional inmates that will be leaving prison earlier than they otherwise would be. So I think everything, we do have very often law enforcement stakeholder meetings where we are absolutely in partnership with our local law enforcement agencies and the counties as we all work through this very big change in the criminal justice system. So it's something that we have continued to monitor. There's been significant monies provided over the last several years for the provision of jail facilities to the locals, recognizing that many of the facilities that existed were not appropriate for long-term offenders, and that's something that the locals are now having to deal with. And so there's been ongoing discussions with local law enforcement and with the counties in terms of the different issues that have arisen post-2011 realignment.
Is the promise of the administration to ensure a constitutional guarantee of funding still valid? Is the governor still seeking to ensure that local governments are made completely whole on this program?
Proposition 30 did dedicate the revenues to the locals.
But we're not getting 100% of what the cost is. Hopefully through the study that Senator Nielsen is hoping to champion with this committee, we'll be able to get that information back. And then a question with regard to the health care expenditures. We spend more on health care, I think, now in the state of California on our criminals in our state penitentiaries than any other state. I think we may have a problem with the receiver. You know, we've had a receiver for a decade now that is implementing the gold standard, if you will, for probably health care. Has there been any efforts on behalf of the administration of the state to challenge the receiver and to potentially ask for a different receiver? And instead of trying to justify the expenditures, we need to cut costs.
At this point, there is a very long history with the three-judge court, especially the Plata court, and the receiver. And I think that in the early years, there was definitely a lot of fighting going on. There was a lot of fighting going on by this administration until the U.S. Supreme Court, the ultimate court, did decide that the prison overcrowding was causing unconstitutional levels of health care in our prisons, or unconstitutional conditions. This is something, we have continued to work very hard with the receiver to make sure we're implementing the actions that he deems are necessary, but it is an unusual relationship. This is a federal court. They do have a lot of directive powers that, we have a duty to implement.
And when are the duties of the receiver considered completed?
That would probably be a better question for him. That's something that we continue to work actively towards transitioning the oversight of the healthcare program within the state prisons back to the state. Small portions have been transitioned back, but that's something that we continue to be in ongoing dialogue with.
Maybe
the receiver's
the LAO
office.
can weigh in. Should we not, as a state, and having a receiver that basically has an open checkbook, set some milestones for the completion of this work, and get back into the business of running our prison system in a more cost-effective way?
The determination of whether or not the state has provided a constitutional level of care is really with the federal courts. The state has tried to work with the federal courts to try to get more clarity on what exactly it has to do. So, for example, the Office of the Inspector General has put together a medical inspection program that's intended to try to help put concrete barriers on what constitutes an adequate level of care. However, ultimately, the federal courts are going to be the one to decide whether the state is providing an adequate level of care. So, essentially, our options are limited.
Okay. Well, I hope we're keeping the pressure on. And then just one last question with regard to the budget stabilization account to the administration. I'm in strong support of having a rainy day fund and understanding the volatility of the stock market, of Prop 30 ending one day soon, the growth in the ACA. There's never been a more important time to augment our budgetary reserves. And I know that $1.6 billion was put into the reserve prior to the Proposition 2 being passed. And I just want to, is the administration committed to keeping that money in the reserve for this rainy day cycle that it's not a matter of if, it's a matter of when it's going to come?
Absolutely. The intent to put that $1.6 billion in last year continues this year, despite the analysis by the Legislative Analyst's Office. That was the intention, was that to put that money in the rainy day fund for the next downturn. So, yes.
Great. Thank you for the courtesy of your answers. Mr. Chairman, thank you very much for the opportunity.
Thank you for your thoughtful question, Senator. I believe, Senator Bell, you had a question, comment, and then go ahead.
I don't want to, because we get to the end, I don't want to particularly go on at length, but I wanted to say I'm finding myself in agreement with my Republican colleagues on some of these issues with the receiver. And I'll just say this. I don't know any person that has a professional experience in treating people that have mental illness that would put 2,700 people in a big facility with correctional officers and mental health professionals and expect to find that that would cause an improvement in the condition of those mentally ill people. And so what we're sort of looking at, the emperor with no clothes here, this receiver has directed the money to be put in a fiscally and developmentally inappropriate place. If you wanted to design a mental health system that is appropriate, you would treat them in the community. By the way, the federal government would help pay for it if we did that. Whereas if we put them in the prison system, we have to pick up the tab for 100% of it. So I think the system that we set up is flawed, and we need to re-examine that with them and have them talk to us about it. It is an inappropriate system to actually treat and expect outcomes that are going to be legitimately improving people's health condition. I think also I wanted to echo Senator Monning's, Senator Stone's, and Senator Leno's comments about the Department of Developmental Service. I looked at the budget of that department. I see that the state operations part of that budget, they do get a COLA. They do get the cost of living built into the budget. But when you look at the community service part of it, it for some strange reason says local assistance, whereas the Latterman Act is a state law. It doesn't have anything to do with local government. It's a state law that directs that we create 21 regional centers and provide service for developmentally disabled people in the 21 regional centers under state Department of Development Services jurisdiction. So it really doesn't have anything to do with local government. So it says in the budget, local assistance. I want to point out that 14 legislators signed a letter back in November asking that the cost of living situation be looked at for that because of, as we pointed out, for several years. I think it's actually more than we thought here, what we're talking about. They have not received a cost of living increase. And the result is that over 100 residential homes in California have closed. Senator Monning said it. I mean, if you want to, we can have each senator just have a meeting in their district with the people in the developmental departments and find out what actually happened in their district. But I think we're finding out in my district, and Senator Monning certainly testified to his meeting. Several of these facilities that take care of the developmentally disabled have been closed, and we really don't know whether or not those people have been put in an appropriate care as required by the Latterman Act. So I think this is an issue that bears scrutiny. We have a state law. I kind of I always have a funny kind of thing. We kind of in the budget observe some state laws, and others we play peekaboo with some state laws, and other situations we're blind to some of the state laws. Well, I think in this case we're becoming blind to the state laws regarding the Latterman Act, and we need to kind of improve that. And look at that and scrutinize that over the next several months, I think. I would suggest also that in terms of the criminal justice system, we look at recidivism rates at all the facilities to find out what works, and then actually go into the counties, because we've had a certain number of years now in terms of the realignment. We need to look at, has there been any models that work? Are there any progressive models that actually reduce recidivism in those counties? I'm concerned about the 60 cents on the dollar. I mean, we have to look at what actually works. One more comment, the Medi-Cal managed care and the waiver. The waiver is supposed to be a budget neutral situation. That doesn't mean we can't do some better things. What we have to do is we have to look at the high cost users and find out what we can do to manage their lives better. And I think in some waivers, like the state of New York and others, are Illinois, Texas, I think, are looking at doing this wraparound thing, including housing, with the Medi-Cal waiver, so that people don't end up in the emergency room 9 or 10 times a year. It includes the fire department, the police department, all these agencies that end up having to respond in an emergency. We used to call them frequent flyers. We need to look at how the high-cost users can have better managed health care with better results, better outcomes, and lower acuity. We ought to start looking at outcomes and lower acuity as a way of being progressive and saving money. And that way we can achieve the budget neutral goal that we have in the Medi-Cal waiver. And then at the same time, provide better service and better prevention programs in terms of our healthcare system. So those are my comments, Mr. Chairman. Thank you.
We appreciate them. Thank you, Senator Bell.